mynews.studio.
A single shot that protects against HIV for months, and a global rise in childhood vaccinations. Are we looking at a turning point for public health?
Today is July 30th, 2025. Two headlines stand out in health news today. The WHO's first recommendation for a long-acting HIV prevention injection, and new data showing childhood vaccination rates are recovering after the pandemic slump. Why do these matter?
Let's start with the HIV breakthrough. At the International AIDS Society Conference in Kigali, the WHO officially recommended lenacapavir, a long-acting injectable that only needs to be given twice a year. That's a big change from daily pills, which many people find hard to stick with, especially where there's stigma or clinics are hard to reach.
Who's likely to benefit most? Is this mainly for high-risk groups, or could it have broader reach?
Of biggest impact will be in regions where HIV rates stay high and daily medication just isn't realistic. With lenacapavir, one shot can mean months of protection. The WHO is urging governments and donors to move quickly on access, but right now, most people outside clinical trials still can't get it.
So what's holding things up? Is it regulation, cost, supply, or all of those?
It's all of those. Regulatory approval can be slow, especially from country to country. Then there's funding and price negotiations with manufacturers. The WHO is working with governments to move things along, but they're also gathering real-world data to make sure the rollout works and reaches those who need it most.
Switching gears, about the rebound in childhood vaccines, how big of a deal is this recovery?
In 2024, 89% of infants worldwide got at least one dose of the DTP vaccine, and 85% finished the full series. That's about 1 million more fully vaccinated children than the year before. It shows health systems are coming back from the disruptions caused by COVID-19.
But there are still children missing out, right? How big is that gap?
Almost 20 million infants missed at least one vaccine, and over 14 million got none at all. Most of those children are living in places facing conflict, instability, or fragile health systems. The progress is real, but the gaps are still significant.
What's behind the rebound? Is it mostly new funding, or are there other factors?
It's a mix. Renewed investment from governments and international groups, focused community outreach, and work to push back against misinformation. Organizations like the WHO, UNICEF, and Gavi are helping countries find local solutions and build support at home.
Will this progress last, or could we see things stall again?
That's the key question. Keeping up this momentum means steady funding and attention. Misinformation, budget cuts, or access problems, especially in fragile regions, could slow or even reverse these gains. It's not just about quick wins. Long-term effort is what really matters.
So, with both stories, the potential HIV shot and more children getting vaccines, are we entering a new phase in global health, or is this just a brief step forward?
There's potential for real change, but only if science, policies, and funding all keep up. These advances show what's possible, but reaching everyone who needs them is the real test.
That's the challenge, turning new discoveries into real-world impact. We'll keep watching to see how these efforts play out and whether this progress continues.
A single shot could transform HIV prevention, and millions more children are protected from deadly diseases. It's a clear example of what working together in public health can achieve.
Thanks for joining us. Today we covered the new HIV prevention shot, the rebound in childhood vaccinations, and the complex path to making these advances available everywhere. These are hopeful developments, but also reminders of the work ahead.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.